Hi, I'm Dr. Susan Milani. This video will demonstrate osteopathic exercises that you can do at home to help your respiratory and immune systems function optimally. These exercises can be done to stay in good health as a preventative measure. They also can be done if you're having symptoms because using the lungs fully helps fight infection. We'll start by calming the sympathetic nervous system to reduce muscle tension. Then we'll improve rib motion to breathe fully. And then we'll use different pumping motions to improve lymphatic circulation and immune function. You're going to need a towel rolled up, a bathroom hand towel, folded it in half, and I rolled it up nice and tight, and then I wrapped 3 rubber bands around it because what you really want is something firm. You're going to put the towel along the middle of your back and then move it off center just a little bit, an inch or so. The top of the towel will be at the top of your shoulder. Then you're going to roll back and lie on the towel. And I like to bend my knees so I can use my feet to push into the towel a little bit. So let your muscles relax onto that towel so you feel yourself kind of sinking into the bed and the towel. After you've relaxed and rested on the towel, which is on the right, you're just going to shift your torso to the left. Shift this area, shift it this way. So you can do that by pulling with your hand if it's around the side of the bed, and it moves, as you can see, this way. And what's happening is the spine is moving to the left and the ribs are staying where they are. So we're opening that area between the ribs and the spine. So we go shift, and you can feel some traction, and if you can add a little bit more of that traction by keep pulling to the left but do a little turn to the right. And it will help the ribs in the back move as you take a nice big breath. And you can hold that and then repeat it a few times. And after you do that a few times, you can just come up, move the towel to the other side, and repeat that on the other side. So you have the bolster on the left. You can pull with your right hand if you can reach around the bed, but you really want to shift your torso away from the towel and turn your spine toward the towel. To do this in the seated position or a semi-reclined position, you probably want to have a pillow behind you, but I'm not using it because I'm hoping that you might be able to see the towel a little bit better. And I'm going to put this towel the same way I did lying down behind me from the top of the shoulder to the middle of my back off center. And I'm just going to lean into the towel and take a moment and let my muscles relax, let my shoulders relax. And then, same thing as on the floor, I'm just going to do a small, as I press into the towel, I'm going to do a little bit of a movement of my upper back and chest away from the towel to the left, and then I'm going to turn a little bit to the right, getting that stretch in between my spine and my ribs. The other way we're going to calm down the sympathetics is to do a little massage around the side of the head. And this is just to relax that fight or flight reflex that doesn't need to be ramped up right now. And you take it around your ears until you feel that bump right behind your ears. So you came around, you're going to come right up under the back of your head, and you're going to press into that muscular area just below your head, and you're going to push toward the center of your head and pull your fingers apart. So I'm keeping my fingers in place, but I'm moving them this way to give a little bit of spreading and ease through these muscles. And you could do this sitting up, you can do this lying down. After that, you're just going to come down the side of your neck to your shoulder, and we're going to open up this area right here where you can hold a lot of tension. The drainage of the head needs to have a very nice soft tissue right through here. So I'm pressing perpendicular to my shoulder, And the reason I'm circling my arm is so that this goes on a little bit more slack and I can really massage and press and move this area. And I can come to the other side. The next area we're going to address is the diaphragm. The diaphragm is a muscle and it's horizontal across the torso. Imagine a mushroom cap and it would be sitting right up underneath your ribs. When you breathe in, that mushroom cap or the diaphragm descends down, and when you breathe out, it domes up. If you've been coughing a lot, that diaphragm can get very, very tight, and then the rib motion is disturbed as well. So what we want to do is check it out and see if it's tight, and if it's tight, we're going to release it. So you're going to take your hands along the edge of your ribs and take the pads of your fingers and just slip them up underneath that area. So you're kind of going deep into your abdomen, and you may feel that it's tender, it's tight. But what I want you to do is just round forward, let a little bit of the weight of your torso come down onto your fingers, and then take a big breath in. You'll feel the pressure coming into your fingers, and when you breathe out, that muscle will dome up, and you'll help it just a little bit if it's gotten tight. And breathe in and out. And as you apply that pressure, the muscle will soften and release. You can move your hands to another spot, maybe toward the middle or out toward the edges. And again, check it out and see if you can get that easy motion of the diaphragm to be restored. Place your hand below your collarbone on the top of your ribs and put your other hand over it. You're going to be taking big breaths in and out, and on the exhale, you're going to be pushing down on your ribs so that the breath gets forced out until it's as far out as you can go. And then on the inhale, you're going to hold down these ribs a little bit so that as you inhale, you're working against the little resistance that you're giving yourself. So it looks like this. And you can repeat this a number of times, maybe 5 to 10 times. At the end, you can hold down a little bit more at the very end. When you start to breathe in, hold it down firmly. And at the very beginning of that inhale, as you feel the pressure build into your hand from that inhale, let it go suddenly. So it looks like this. And it gives you a nice breath and fills everything up. Repeat that on the other side the same way. Now you're going to come to the lower ribs, wrap your opposite hand around and place it on the side of your ribs, and your other hand goes over it. So the same idea, you're mobilizing your ribs by using this pressure. So you breathe in, and on the exhale, you add that rhythmic pressure. Inhale again. And again, you can do that 5 to 10 times. Repeat on the other side. The next one is a pumping motion in the abdomen. It's right over the belly button, and you can place your hands over each other. This is a gentle pumping motion to help, again, bring that lymphatic fluid into circulation. If you've had recent abdominal surgery or you have a very painful response to this, please don't do this. We're going to breathe in and out. The direction that you're pumping is toward your spine, down toward the bed, and a little toward your head. And you can repeat this up to 10 times or more. Now we're going to rock and get a nice pumping motion through the whole body that starts at the ankles. So you're moving your toes up toward your face and down, and you do this rhythmically. You should feel that your belly's moving. You should feel that your upper chest is moving, and even up into your head it is rocking as well. And this gets all the fluids throughout the whole body moving through that lymphatic system, and you can just rock back and forth. If that's difficult, you can place your feet up against the wall or the bed and push against something, and that'll help the rocking motion as well. And if you're having trouble with your ankles, you can also bend your feet, bend your knees, put your feet flat, and just rock from your feet by pushing and pulling yourself with your legs. And this can be done, 20 seconds, 30 seconds, repeated through the day. It's a good way to get the whole lymphatic system going. The pumping motion from the feet can also be done lying face down. And in that case, you rock from your toes and your arms. Each of these exercises addresses a different component of respiration and immune function. When you take a big breath in, you put it all into action. So let's end with a big breath in. You'll breathe in fully, hold for 10 seconds, and then exhale slowly for 10 seconds. This can be repeated a number of times. The way you use these exercises will depend on your condition. If you're healthy and vital, you can use them as a preventative measure and do them more vigorously for a longer period of time. If you're having symptoms, you're weak, you're fatigued, then you want to do them for a shorter amount of time, maybe 10 minutes, and repeat it 3 times throughout the day. Stay healthy and keep breathing.